teeth are a very important aspect of our lives. First of all, we would look really weird without them unless we're babies. Secondly, they are important to our continued health, and it is always best to start off our dental health at a very young age. But it's also good to have someone that really knows what they're doing with kids. Here with me from All Kids Dentistry is Dr. Laura Greenwald. Good morning.
Good morning.
So was I right, at least in my setup here? Is it important to for good dental health?
Extremely important, starting at about 1 year old.
So 1 year.
1 year.
So you specialize, of course, with the name of your dentistry, All Kids Dentistry. So you specialize not only in pediatric dentistry, but also with special needs children. So tell me a little bit about that.
Correct. We specialize in kids. We see them up to about 18 years old, and my special niche is children with special needs. Variety of special needs could be anywhere from anxiety to being on the spectrum. We have kids in the practice who have mobility issues, swallowing issues, and we really cater to that type of family. But we also see just the typical kid, and because kids are not little adults, their dentistry is quite different.
Well, I would say I know plenty of adults who act like kids when they have to go to the dentist. So there's still, though, it's a different type of attitude. Like most of us will just kind of grin and bear it, or like me sometimes, depending on when that scraping starts, I just kind of grab my thighs and hold on until they're done. But kids are different because they are sometimes very vocal and, of course, very scared, or could be. And so is there a technique to keeping them calm, or is it just a part of the practice? Now, you've also had actually experience from an education standpoint in pediatric dentistry as well, right?
Right. I am board certified, so I have extra education in psychology and how to use different behavior management techniques to prepare children for the anxieties of coming into the dental office. And one of my biggest tools in the office is preparing kids beforehand when they sit down exactly what they're going to experience, from the sounds and the smells and the feel to all the tools that we'll be using. So it's a technique called tell, show, do. So we tell them, we show them, and then we do it, and we don't lie. And there's certain language we use. We don't, use adult language. We use very child-specific language. And if they feel more in control, they're less likely to be anxious, and we're more likely to have a successful visit.
I'll tell you, and I briefly touched on this when I was like 5 years old and went to the dentist, and didn't even know that I was going to get my teeth pulled. And right as he's coming at me with the little pliers or whatever, then he yells at me because I started freaking out. So, right. Like I'm telling you, those types of anxieties, and of course, and then you're traumatized by that afterwards for me for quite a while. So we're talking about someone who specializes in your case, especially if you've had kids, you've taken them to other dentists or dentists who maybe aren't board certified. Maybe they're the dentist that works perfectly fine for you as an adult, but the kids get kind of a little freaked out going. You're an alternative that really, from a board certified perspective, understands how to deal with them.
Exactly, because we want to set these kids up for good oral health for the rest of their lives. Even after they graduate from my office, they're going to need to take care of their teeth. And teeth are not isolated. They're part of the whole being. And we know that there are certain dental diseases that are related to other diseases, heart disease. And we really just want to create a positive environment so that for the rest of their lives, they actually maybe would enjoy going to the dentist rather than fear it.
Exactly. And tell me a little bit about your background, because I was reading that you, aside from just going to dental school, you also got a lot of experience in Indian reservation where there was a lot of decay, so really a lot of work having to kind of a really good experience there, right?
Right. After I finished my residency, my specialization in pediatrics, I got a National Health Service Corps scholarship through the government, and I was working for the Indian Health Service on Navajo land. And I was really focused on the kids under 6 years old. There's a high decay rate there. And I really got a lot of experience being in the operating room and just, becoming more confident and more swift in my procedures, but also perfecting them. So when I came out of that 2-year commitment and going into private practice, I felt like I really had a good background.
It sounds like you do. Now, I want to talk a little bit about maybe some tips for parents to think about with their kids, because I know nowadays it's very easy to drive through the Starbucks or the big coffee house conglomerates after school and get the extra over sugared stuff. But is there something maybe the parents should consider as an alternative to kind of maintain that or prevent as much tooth decay as possible?
Well, we always push more water, but, I'm a mom too, and, we want to enjoy our lives. So it's okay to have that occasional milkshake or, Frappuccino. But as long as we do recommend brushing 2 times a day, morning and night, with the nighttime brushing being the last thing you do before you go to bed. So there's no food or sugar in the mouth sitting on the teeth. And then regular flossing if possible, even if that's 3 times a week. I'm realistic. Like I said, I'm a mom, and sometimes you don't get to that every night. But I really try to encourage these home health care needs, as kids usually see me about every 6 months. So it's up to the parents at home, and we give these parents tools to take care of their children. So if there is sugar being eaten, doesn't have to be candy, can be bread, rice, tortillas. We want to remove that at the end of the day. And obviously using a fluoride toothpaste is recommended, right, even under 3 years old.
And getting them started as early as 1 year old, bringing them into the dentist that young.
Exactly. The AAPD recommends setting up a dental home by age 1, just as you would see your pediatrician. We like to set up early oral health care at age 1. God forbid there's a trauma, kid falls while learning how to walk, you have a place to go. You have a friendly face to come to if there's a trauma. Even on the weekends, I do take calls. So not only setting up good oral health care, but having someone to take care of your child in time of emergency is very important.
And check your kids too, because one of the things that got me in trouble as a 5-year-old, why I had cavities, I had to have my teeth pulled, my molars, a couple of them, is because I would go, I brush my teeth, and then so always double check those kids. I know you want to believe them. All Kids Dentistry, SCV.com, and you'll be at our Home and Garden Show coming up this coming spring.
I will.
And so you'll have a booth with information and all that other good stuff.
Yes, I will.
You have a dentist chair there?
We might be doing some screenings. Yeah.
Well, that's perfect. And so we're looking forward to that. Dr. Laura Greenwald, thank you so much for coming by, and really appreciate that information. And make sure that your kids get their good dental hygiene in early. All Kids Dentistry, SCV.com. Thanks so much for stopping by.
Thank you so much.